Hello, my name is Cordell and I am doing a case presentation on a case of a patient that I had, and it's going to be a health history risk assessment report. I have a Judy Lyons Murphy, gender is female, date of birth is 05/20/1959, race is African American. She is here for a annual checkup. H&P is Judy Lyons is a 63-year-old female who presented to the office today for an annual visit. She is overall reporting that she is well since her last physical a year ago in 2021. Her mammogram and pap smear that was done on that visit was normal. Miss Murphy had some health screening advice for cholesterol and A1C on 9/20, and they were both normal. Her last colonoscopy was done in August of this year, and that was normal. She takes her asthma inhaler daily, and the last time was September of this year. No current complaints on visit. I'm going to do a past medical history. Patient has a past medical history of asthma that started 5 years ago. She was diagnosed with hyperlipidemia 6 years ago, and she has been diagnosed with hypertension for 20 years. She had, for surgeries and hospitalizations, she has an orthopedic surgery on her left foot in 2013, no hardware, and a hysterectomy 26 years ago. Vaccines and immunizations, she takes her flu vaccine and up to date with COVID with the booster. Currently, patient is doing well. Allergies, patient reported that she has environment allergies such as cats, pollen, and mites. Medication allergies are morphine, latex allergies, and no food allergies at this time. Medication, patient is on Symbicort, that is inhaler daily, albuterol inhaler PRN. She's on Lipitor 40 milligrams once a day. She's on Losartan 50 milligrams once a day. She's on Xarelto 20 milligrams once a day. Chlorothalidone 25 milligrams once daily. Cetirizine 10 milligrams once a day. Azelastine nasal spray twice a day, BID. Nasal wash PRN, and eye drops as needed. Patient's family history. Mother had hypertension, angina, and diabetes, who passed away at age 86. Father, cancer of the lung, passed away at age 46. She has 4 sisters, and sister number 1 has hypertension, cardiovascular problem of unknown origin, and hyperlipidemia. Sister number 2 has hypertension, hyperlipidemia, and cardiovascular problem, had an MI. Sister number 3 has hyperlipidemia. Sister number 4 has hyperlipidemia. She has 2 brothers. Brother number 1 has prostate cancer and cardiovascular problem. Brother number 2 has hyperlipidemia. Chemical and drug use. Patient reports no ETOH use, tobacco or nicotine, or no recreational drug use. Daily routine such as diet, exercise, and caffeine intake. Patient has a DASH diet and walks every day. Reproductive history and sex. sexual history. Patient's last menstrual period was 27 years ago, and not currently sexually active. Social history. Patient goes to church on Sundays and visits with family and friends for events. Patient is a retired registered nurse, former occupation, no military background. Patient's ADLs, she walks daily, does light housework, and cares for herself independently. Safety. Patient lives alone in a townhouse condo with alarms and interior cameras. Review of systems. Patient is well appearing, ANO ×3, normal mode and effect. Eyes, contact lens, correction lens are in use. No complaint of eye discharge, redness, dryness, or itchiness at this time. Ears, nose, and throat. No complaint of nasal bleeding, postnasal drip, congestion, or throat pain. Cardiovascular disease. No complaint of chest pain, palpitation, or rapid heart rate at this time. Respiratory. No complaint of chest tightness, shortness of breath, or cough currently. GI. No complaint of abdominal pain, abdominal cramping. Last bowel movement was this morning. GIGU. No complaint of difficulty urinating, foul urine, burning on urination, or dysuria. Musculoskeletal. No complaint of joint pain, back pain, loss of strength, or difficulty walking at this time. Neurological. No complaint of memory loss, changes in reasoning, clear speech, and ANO ×3. Psychiatric. No complaint of depression, feeling down or out and lonely. Hematological. Taking blood thinners, but no swelling of lymph nodes or signs of bleeding. Allergy immunology. Taking medication as ordered for allergies, no fever or chills present. And this is the review of systems. Risk analysis is that this patient is at risk for stroke due to hyperlipidemia, which is a great concern if not monitored effectively. This patient is at risk because of a family risk of diabetes to develop diabetes in the future if not managed well or monitored. This patient is at risk for bleeding because she's on a blood thinner. Any head injury, any injury to her body should be taken with serious precaution just because of the increased risk for bleeding. This patient also has multiple allergies and could continue to develop allergies that this person should be monitored or notify all providers of her allergies upon arrival to a healthcare facility. Currently, patient is doing well and no further tests is needed. This concludes our video.